Hi, you're engaging in the ELA Guidebooks Unit Restart. The purpose of this video is to learn more about amnesia and how it affects people's lives. This will help you better understand the obstacle the main character Chase goes through in your unit text restart. Be sure to have your handout available and something to write with for the video. Imagine waking up staring at two people who tell you they were your parents, but you feel as though you've never met them. In fact, you feel like you don't even know yourself. When a person suffers from amnesia, this means they have a loss of memory. It can cause you to forget simple things like your name, remembering faces of family and friends, or even what happened to get amnesia in the first place. A person who is a little forgetful in their day-to-day life does not have amnesia. Amnesia refers to a large-scale loss of long-term memory due to illness, brain injury, or psychological trauma. Most people with amnesia are able to think clearly and have a sense of self. In some cases, they may have full memories up to a certain point in time. Most often, the memory loss is patchy, with a person losing memories of certain events. Some people with amnesia find it hard to imagine the future. This is because the human brain constructs future scenarios based on its recollections of past experiences. Now you're ready to answer the question, what is amnesia? Pause this video to record your answers on your handout at the first stop sign. Then hit play when you're ready to continue. Let's review. Amnesia refers to a large-scale loss of long-term memory. This can happen because of illness, brain injury, or psychological trauma. Several different conditions involve amnesia, and there are many different types. Some features of different type of amnesia can overlap, and a person can have more than one type. Amnesia can be temporary or long-lasting. The most common types of amnesia are anterograde amnesia, retrograde amnesia, and traumatic amnesia. A person with anterograde amnesia cannot remember new information. This usually results from brain trauma, such as a blow to the head that causes brain damage. The person will have their full memory from the time before the injury. In some way the opposite of anterograde amnesia, retrograde amnesia is when a person cannot remember events that occurred before their trauma, but they can remember what happened after it. In rare cases, both retrograde and anterograde amnesia can occur together. Traumatic amnesia refers to memory loss resulting from a hard blow to the head, for instance, in a car accident. The person may experience a brief loss of consciousness or coma. This type of amnesia is usually temporary, but its duration often depends on the severity of the injury. Amnesia can be an important indicator of concussion. Now you're ready to compare the different types of amnesia. Pause this video to record your answers on your handout at the second stop sign. Then hit play when you're ready to continue. Let's review. You should have matched anterograde amnesia with B, referring to a person who cannot remember new information. This usually results from brain trauma that causes brain damage, and the person will have their full memory from the time before the injury. Retrograde amnesia should have been paired with C, referring to a person who cannot remember events that occurred before their trauma, but can remember what happened after it. Last, traumatic amnesia should be paired with A, referring to memory loss as a result of a hard blow to the head. This amnesia is usually temporary, but its duration often depends on the severity of the injury. Any disease or injury that affects the brain can interfere with memory. Possible causes of amnesia include stroke, illnesses that cause brain inflammation, which typically include bacterial or viral infections, oxygen deprivation, which may result from a heart attack, respiratory distress, or carbon monoxide poisoning, some medications, bleeding in the area between the skull and the brain, a brain tumor that affects a part of the brain involving memories, head injuries, which can lead to loss of memory that is usually temporary, and surgery and anesthesia, which can cause a person to have trouble remembering what happened right before or after the procedure. Now you're ready to list 3 causes of amnesia. Pause this video to record your answers on your handout at the third stop sign. Then hit play when you're ready to continue. Let's review. You could have listed any of the following causes of amnesia: stroke, brain inflammation, oxygen deprivation, some medications, bleeding in the area between the skull and the brain tumor, head injuries, or surgery. In many cases, amnesia resolves without treatment. Medication and related mindfulness activities may help a person relax the mind, which may help retrieve forgotten memories. Family support is also crucial. Showing a person photographs of past events, exposing them to familiar smells, and playing familiar music may help. You will use this new knowledge as you engage in the ELA Guidebooks Unit Restart. When you finish this video, be sure to turn in your completed handout to your teacher.